My name is Dr. Lucinda Canty. I am an associate professor at the LA Mayor College of Nursing. I am also director of our Seedworks Health Equity and Nursing Program. So how I got started into nursing was I always had like the desire to do it, and then in high school I knew that I wanted to become a nurse. And as far as midwifery, when I was a nursing student, I wanted to work with babies. I wanted to work in the newborn ICU. But I did a special rotation, and as I was on the unit, a woman came. She was being brought to the unit, to her room, and she was screaming. She was very uncomfortable, and someone jumped in and was like, she's giving birth and just delivered her baby. And I didn't even know what a midwife was, but I was like, I want to do that. And they're like, she's a nurse midwife. I'm like, I want to do that. So that started my kind of journey into midwifery. So poetry and art were always things that I loved to do. But when I started nursing school, everything was science. So it was something I did, but I couldn't spend as much time as I wanted to because I had to focus on biology or my nursing courses. So it was kind of put in the back burner. I would do a little here and there, but I was also very, I don't want to say private, but maybe I will say private, because I was a little shy about showing my art because I was like, I don't know how people are going to respond. So it wasn't until I was working on my dissertation and I was doing research into maternal health, and I used Van Manen's interpretive phenomenology, which allowed me to use art to express the themes. And so it was like when the women told me their experiences, and I interviewed women who had severe complications during childbirth. So they were telling me very personal things about their experiences, their emotions, and I just felt like I could capture it in words, but I wanted people to be able to see it as well. So I did art to represent, I had 5 themes, so I had art to represent each one. And for me, it was rewarding because when I went back to the moms to see how they felt like I captured what they were saying. So when I do presentations, I still use my artwork to kind of help to represent the experiences. Sometimes it's like we have to talk about difficult content, we have to talk about racism, we have to talk about loss, and with art, it provides that space to be able to talk about it without it being so much into your face. That people see it and then they interpret what they see, and then I'll add in the voices of the women that I interviewed. And so it just makes it a more subtle kind of way to talk about some things that are really deep. And it's like a piece that I use to get people to talk, but to also get people to see this is someone's real life experience. But the other part is that we focus so much now on like the darkness of pregnancy and childbirth, and I want to say there's still beauty. It's always been there. So let's look at the beauty of it, even though things could be challenging, but it doesn't mean we can't do anything to keep it where it should be. So I just say that it's like you have to learn a way to kind of navigate so that things don't have to be so serious all the time. Because especially the work that I'm doing now, where I'm in the community, I'm seeing things that need to be done. You know, I work with mentoring students, so sometimes they have challenging experiences, and it could weigh me down. But if I could go home and I can paint something, if I could work on poetry, and then if I share that, and I have to tell you, this is the most beautiful part of it, is when I have a painting and someone says, oh, I see myself. You know, when I have a painting and someone says, I never thought about pregnancy that way, but now that you said it this way and that you had this poem, now I'm looking at things differently. So those are the things that really show how I can pull all these pieces together. Because sometimes we get caught up in giving statistics, or we'll say this is what I found. But when I add the art pieces in, it kind of like draws people's attention in, and then when I add in poetry, to kind of summarize, I feel like poetry helps me sometimes articulate what it is that I'm seeing as well in the work that I do. And I have to also say that poetry for me is a way to kind of alleviate stress, alleviate anxiety. But also I have these thoughts, because it could be very heavy. There's a lot of joy with childbirth and pregnancy and seeing that baby, but there's also sometimes a heaviness when people tell you of some not so positive outcomes. But it gives me like some peace. Black woman pregnant, this was one of the first pieces that came out of my dissertation. So when I first started looking into racial disparities, I was told, they're poor, they don't have insurance, they start care late. And when I interviewed the women, they were none of those things, but they were still at risk. So there was something at the time that I still didn't understand, but they showed up, and just as Black women, but found themselves in life-threatening situations. So I just want to show that just being Black, being pregnant, that you're, even though we say race is not a risk factor, racism is, but I want to show how we just show up. And then again, all these assumptions are also made about us. So this painting was to show that she can be beautiful, she can look healthy, but we still feel like something can happen, or we're nervous about something happening to her. So uncertainty, that picture was also it was like, again, listening to their stories. And the women talked about having that moment when they didn't know if they were going to survive. One woman had a cardiac issue, and her providers told her, we're going to prolong your life. One woman she just had a cesarean. Baby came out, she could hear the baby crying, but they couldn't stop the bleeding from her incision. And she just remembers them saying, we're going to have to put you to sleep to do a hysterectomy. And she said, all I could think about is who's going to take care of my baby if I don't wake up. So she had a full-blown anxiety attack. But it's just being in that space where you don't know if you're going to make it. And when you think of childbirth, I could ask anyone. I could even ask a male and say, what are you most concerned about? They'll say pain. Everybody's worried about contractions. But to hear someone say that they're worried if they're going to survive, that's that uncertainty. So that's where the painting came from. So it's 3 dark figures. The invitation. I was invited to the party, but I was not allowed to dance. While the movements were beautiful, I realized I could not see any traces of myself. Where was I in the sequence of expressions? How could I fit in when I never learned the steps? As the dance became more complex, I could see myself floating further and further away. I was given a seat at the table, but I wasn't allowed to speak. Expected to sit quietly while others spoke their truth, using a language I never understood, words so eloquent I could not see them eradicating my existence. My silence signified an acceptance I never consented to. My contributions made absent in this never-ending story. My challenges never heard, my story never told. It was as though I do not exist. Maybe, just maybe, I was not expected to accept the invitation. So Black History Month is important to me because I feel like sometimes day to day, we don't have time where we focus and learn things that I feel like are essential to who we are. So Black History Month is always that time of the month where, I should say time of the year, where I'm able to say, let me look at my history and let me see where nurses have, what they have done, like from the very beginning of time. So it's important to me because history helped me kind of see where I've come from and where I'm going. And by that I mean that when I first started nursing, it wasn't very diverse in some of the classrooms that I sat in. I didn't learn about nursing or the history of Black nurses. And so when I did have, I would say, stressful times, I came across this book, Black Women in White. And it went back to Harriet Tubman practicing nursing, and I never knew that. Sojourner Truth practicing nursing, and how we were in our communities practicing nursing before we knew about Florence Nightingale. And so it just gave me strength because knowing that during this day and age, I'm supposed to have more rights. I'm supposed to be able to do more. I shouldn't have any limits. But I realized that they had less than what I have now, and because of them, I'm here. And so I find strength in that. So I always use this month, especially on social media, I'll pull out that history and share it with future nurses or nurses who are currently practicing, just so that they can see and they can think about and reflect on kind of where we came from, and then again see where we're going.